What's up, everybody? Does your neck get tight or sore after working at your computer? Do you get numbness and tingling into your arms or even your hands? Do you suffer from headaches? Or is it hard for you to turn your head or move it in a certain direction? Most, if not all, people have suffered from some sort of neck pain. Whether it be waking up to just a stiff, creaky old neck, to having tight neck muscles after doing some physical activity or working at our computer all day long. It might even present itself as neck pain with shoulder, arm pain down into the hand, numbness in the fingers, tingling, or weakness on one side. The specific cause of most neck pain is unknown and usually unidentifiable. It's hard to point to exactly why your neck is hurting. But there are contributing factors that we do know of. I'm Dr. Jake Shockey. I'm a chiropractor. Now, let me explain to you what some of the common causes of our neck pain and headaches are and what you need to be looking out for. Maybe we can classify you into one of these categories and figure out exactly why your neck has been bothering you or what's bringing on those headaches. Then we can get you in the office. We can come up with a care plan and we can treat you to get rid of that stuff and make you feel good again. So let's talk about some of these common causes here. Number one on the list is muscular strain or ligamentous sprain. So that could start from just sleeping on your head the wrong way, looking to one direction for too long. And what's going to happen with this is you're going to have pain with range of motion. If it's a ligament, you're going to have pain when someone else tries to turn your head or look a certain direction. Or if you have trouble resisting range of motion in a certain direction, then we know it's most likely going to be a muscular strain that's causing that neck pain. Next, we have the disc. So our intervertebral discs, the soft, cushy material that's in between each intervertebral disc, can be responsible for a lot of pain. So degenerative disc disease is oftentimes the name of the game here. So what happens is that disc starts to deteriorate due to posture, a life of certain work habits, physical activity, whatever it might be. The disc starts to wear down, it gets thinner, you start to get the bones closer to each other, you start to get less room for your nerves to operate as a end result. Ends up radiculopathy or radicular symptoms coming from that specific area and moving peripherally out into the shoulders, down the back, into the arms, hands, and wrists, can often be just because of degenerative disc disease or herniated discs, blown discs, any issues with the disc, which then gives the nerve less room to operate. Third on our list, trigger point referral. So most commonly, upper trap trigger points, these big beefy muscles in all of us, they become too hyperactive because we're stressed out, and everybody carries their tension up here because we're stressed out here, or we sit at a computer or our phone like this and we just place stress on these muscles all day long and we never give them a break. So they become protective and the brain develops trigger points in these muscles. Oftentimes our suboccipital muscles, the muscles right there at the base of our skull and the back of our neck, can also become very, very tight because we're either here or we're like this. So we're kind of overusing and abusing some of these muscles. Next on the list, number 4, osteoarthritis. So osteoarthritis, we often hear many times people say, oh, I have arthritis. Well, what does that even mean? Osteoarthritis is the brain and the body's want to create stability in a joint. If the brain does not sense stability there, it's going to start laying down new bone. So when your vertebra used to be nice and round, now all of a sudden more bone is going to be starting to get built up around the outsides to give it a bigger base to create more support. Sometimes the new bone, though, is not always smooth, or it's not in a spot that the rest of the body likes. So what that does is it rubs on some of the nerves and can send pain signals elsewhere into the head, down the arm, and so forth. So osteoarthritis, the body's laying down of new bone, creating bone spurs, looking for stability, often causing pain. And last on our list, stenosis. Most of the time, this doesn't occur until you've hit 60, 65, 70 years old. Basically, what this is a narrowing of the hole that the nerve is going to travel through. So instead of having a ton of room for that nerve in your intervertebral foramen, this is going to lead to pinching of the nerves, rubbing on the nerves, inflammation that's going to spread chemicals to the nerves, oftentimes giving pain perception elsewhere. So narrowing of the foramen causes either clamping of the nerves coming out at the nerve root or of the actual spinal cord that's going up and down the spine. Next, let's talk about an exam. So one of these factors is you have some of these symptoms, you come on in, make an appointment. Here you are. What are we going to do for you? So first, we're going to do a very, very thorough and detailed exam to figure out exactly what your history is. Do you have a history of trauma? Are you using any medications? And we're going to find all of those things out. We're going to rule out major red flags to the head or neck area. So fever, dizziness, facial numbness, headache like you've never felt before, or any other medical red flags that we need to say, hey, time out. You need to be in someone else's office. If all of that's clear, we're going to move on. We're going to do a very thorough and detailed ortho and neuro exam to make sure that we can identify some of the contributing factors and rule out some of the other things that could lead us to a different diagnosis. Chiropractors, we use our hands the best, so we're going to palpate. We're going to feel for any trigger points, muscular tension, joint restrictions or joint blockages. And then from that, we can use some of our treatments. The palpation skills are going to lead us to be able to decide which treatment is best for you. Finally, during our exam, we're going to assess breathing. This is a part of all of our exams because breathing in the way that our diaphragm and our pelvic floor operate together has a direct effect on the way the body operates. The way muscle holds tension, has trigger points, and the rest of our body's function, all the way from strength, sensory, range of motion, motor skills, tone and tension. So that's what a quick look at what an exam in our office is going to look like. We're going to rule out major red flags. We're going to do ortho neuro to figure out exactly which tests are positive. We're going to palpate to figure out what is going on. And then finally, we're going to do a breathing assessment. All right, so now that we've talked a little bit about what an exam might look like, let's get into what treatment is going to look like here. So basically what we need to do is decide if this is a case that needs more mobility or a case that needs more stability. So most of the time, especially kind of in the neck region, we're going to be looking at a little more mobility versus stability, followed by stability. First thing we're going to do is classify the patient. Then, assuming that it's a mobility problem, we're going to use our adjustment tool. So we're chiropractors, we're going to use our hands, we're going to palpate and figure out which joint sections or areas are just not moving the way they should be. We can do that by watching the patient go through ranges of motion, listen to what they have to say, and then put our hands on the patient and see which areas just aren't moving the way that they're supposed to be. So that's where we'll adjust. So when you get adjusted, we're just going to be giving a little bit of more motion or a newfound range of motion. So what we have to do after that is come back and stabilize. So if that's the case, we'll adjust and then follow it up with some of our DNS exercise. So what that's going to do is take this new range of motion and then teach the brain how to use it, stabilize it, and then from there we can kind of continue to progress treatment. So also a mobility approach would be the McKenzie technique. So end range loading kind of looks like a goofy face, but basically we're just trying to slide our chin back as far as we can. We're trying to load the back side of those joints and just create more motion that we're just not used to getting. So again, follow that up with stabilization work. And then we can also palpate with our hands and assess for trigger points or tight muscles that are contributing some of our pain symptoms. So oftentimes trigger points are just going to be a good functional audit for us. So each time the patient comes in, we'll check, and then that lets us know if the patient is progressing, not really kind of plateauing, or not really progressing at all. So trigger points and range of motion are some great just audits that we use each time the patient comes back. Trigger points, especially kind of in this upper quarter, oftentimes happen here in the traps and back in the suboccipital areas, kind of basically where the muscles attach at the bottom of the skull. So oftentimes trigger points in these two areas can contribute to headaches, radicular symptoms, which could be like numbness and tingling in the fingers, which people often mistake as carpal tunnel syndrome, or like a muscle weakness. People will often say, I'm just having trouble carrying something at work, or it's harder to hold on to my coffee cup, things like that. So trigger points can often be just calmed down or eliminated basically with some dry needling and then stabilization work. Next, a traction unit for some of our stenotic patients is often very helpful. So they might not respond as well to McKenzie work or even the adjusting or dry needling, but they just need to create a little bit more space for their nerves and spinal cord to be able to operate. So basically a traction unit is just going to traction them kind of up and down slowly, often very comfortable for the patient and very effective. So in a certain patient population, usually kind of later in life, we do see some stenosis start to creep in, and a traction unit is kind of a home run for those patients. And then finally, we're going to try to educate the patient, explain to them why they're feeling this or how it came about, and then what to do about it. Most of the time, breathing is going to play a role because everybody breathes with the chest and the shoulders, and then they wonder why they have headaches or tight shoulders. Posture is going to be a big thing, and just taking some, we call them micro breaks, but basically just taking small little breaks, getting up, adding in some movement, reestablishing good posture. There's no one right or wrong posture, but just varying things throughout the day is going to be a home run for us. Especially since after COVID happened and everybody's either working at home, on a laptop on their couch, or they're on a bar top table. We just don't have a great setup. And some people in office, they might not even have a great setup either. So we'll kind of address that, take a look at it, and see what we can kind of tweak to be able to basically give that patient a little bit of relief during their day. So we've kind of talked about the treatment, but what are you going to do at home? We can't go home with you, so we're going to send some exercises or some things to think about instead. So we love a foam roller. So just a good old-fashioned foam roller, nothing special. We love it for the mid-back to upper back, not on the neck, and we'll never do it on the low back, but just kind of that mid to upper back where everybody's stiff from kind of being hunched over, to create a little bit more upright extension and to create a little more relief there. So if we can get that mid to upper back moving a little bit more, kind of take some tension off of that, it'll decrease the load kind of on the shoulders and the neck and even the low back too. So Love the foam roller. The McKenzie work goes home well. It's pretty easy to do, easy to grasp. The big thing with that is just going to be setting reminders, making sure that we're getting all the reps in, because it's a high repetition thing. So you can't just do 5 or 10 reps and expect some results. So that's a good one. And then our DNS exercises, they don't go home as well, just a little bit more complicated and kind of they need to be coached a little bit. So we love those in office. Certain patients we might send it home with if they have kind of a good feel for their body. But really love that in the office. Also, another thing that can be used at home, I mentioned, is a traction unit. So a patient could potentially go buy their own traction unit, have it at home, use it 1 or 2 times a day, and get some relief kind of in between chiropractic visits. So since we can't go home with you, and maybe they need relief more often than just once a week or twice a week or whatever their treatment plan might be, they can add in that just kind of as a supplement and get some short-term relief for a stenosis type patient. And then finally, I already kind of talked about it, but just changing and being aware of breathing and posture and work ergonomics as well can often kind of help keep all of the symptoms away. So what we're doing is just trying to change function. We're trying to change range of motion and trigger points and tension and kind of where the body's holding it. So just kind of educating throughout the whole process on how to basically manage pain, get rid of pain, and then change function to be able to kind of keep all this stuff away. So now that we've kind of talked about what some causes of like the neck, shoulder, head pain might be, I took you through like what a brief exam might be like, some quick treatment things that we love to do, and then even just some home exercise or take home homework that works pretty well.